And now to the latest on the coronavirus. The United States is reporting the highest number of deaths in a single day, nearly 1,500. CDC Director Robert Redfield says everyone in America needs to wear a mask, or this coming fall could be, quote, the worst we've ever had. Alex Perez reports from Chicago.
This morning, researchers used by the COVID task force predicting 3 of the next likely hotspots for the virus to hit Chicago, Boston, and Baltimore.
We're just seeing significant transmission in all 3 of those cities. That's happening late in the summer, acknowledging that they only have weeks left before the nights get colder and the transmission dynamics may actually worsen.
Researchers from Policy Lab at Children's Hospital of Philadelphia say Chicago has a high transmission rate and inadequate social distancing measures. Boston's transmission rate is growing and many are traveling for leisure, according to cell phone data. Baltimore at risk because of its high density and poverty rate and large number of multi-generational households.
I worry about a perfect storm.
Traveling ICU nurse Trinity Goodman knows the challenges of hotspots all too well, working in New York when the pandemic first hit.
I felt this almost like a deeper, calling to go.
And more recently, the Texas border, where she says all her patients were under 40 and not one of them lived.
We had literally had no resources.
And Alex Perez joins us now. Alex, I want to pick up on that last statement we heard in your piece. Is this nurse saying that people in Texas are dying because there are no resources to give them proper medical care?
Well, Diane, what she's saying is that many hospital systems are simply overwhelmed right now. So accessing treatment, accessing equipment, accessing PPE, a lot of that stuff is just taking longer than it should right now. And all of that is adding to this problem, Diane. So it's a very complicated situation. And making things even worse is that in some communities, a lot of people are just not adhering to those social distancing guidelines. So the infection rates are going up. Again, overwhelming the hospitals. Diane?
And Alex, what's the sense you're getting in terms of what's being done about this, locally and federally?
Well, officials across the country are doing what they can, they say, to try to get that PPE, to try to get that equipment. Governors, in many cases, have taken this into their own hands instead of relying on the federal government and finding that PPE, buying it themselves. I know here in Illinois, Governor Pritzker, one of the things he did was he found PPE from other parts of the world, brought it here. It was flown in secret into the Chicago area and distributed to other parts of the state. So really everyone, in some ways, kind of looking out for themselves, trying to get these medical experts, these doctors, the equipment that they need to try to treat people.
And of course, Alex, as schools reopen, that's adding another concern. Now the White House is issuing guidance for schools and also sending them masks. What are the details there?
Well, that's right, Diane. The White House has issued these guidelines, and they say among the things that students and staff should be doing is self-assessing their health every day, washing their hands and wearing masks when social distancing is not possible. But educators across the country have already said that returning to school, in-person classes this fall, they believe is just not safe. Diane?
So many schools we know are setting up COVID-19 task forces. They say to keep students, staff, and schools safe. Who are on these task forces and what are they doing?
Well, it's what's happening across the country right now at every school district. School officials working, trying to come up with a plan to get students to school safely. So they're turning to immunologists and other doctors that can help them build a safe medical plan moving forward so that students, in some cases, can return to classes. Now, this is particularly difficult for some smaller school districts who don't have as many resources as the bigger districts. One of them in Scienceville, Indiana, has been working on this for several weeks now. Let's take a listen to what some of the teachers and school officials there in Scienceville have to say about all this.
I had a very extensive back-to-school protocol, and they are social distancing and wearing masks, and the teachers are keeping them in one classroom. Yeah, I think they're doing their best with the information they have. They've got extensive plans. Lots of brains were definitely put together to come up with some good plans.
Professionals who I have determined to be sufficiently objective, who are external experts in their fields, and don't have kids in our schools such that they're, worried about childcare or what decision I might make. These are scientists who can be objective about things. That's the way I wanted to run it. This is a global pandemic, and we should handle it as positively and as discreetly as we can.
And Diane, another big concern that experts are turning their attention to right now, it turns out some of these outbreaks that we have seen over the summer, well, they've been traced to restaurants and bars. So medical officials now keeping a close eye on all of that. Not a lot of good news when it comes to what's coming in the future here. So authorities are just telling everyone to try to practice these guidelines and really keep that top of mind, because they believe that's the only way that we can sort of get ahead of this right now. Diane?
Outdoors better than indoors, and it seems as the weather gets colder, we will be indoors more, Alex, so hopefully we can all stay safe. Thanks for the update.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.